1042, welcome back. Do you struggle with heartburn? Many Americans do, but when is the time to get help for that? It's an important question, and we are getting answers today. We are joined live by Dr. Hussein Wazaz from the Midstate Gastroenterology Specialist. Dr. Wazaz, welcome back.
All right, thank you, Natasha. So the message today is heartburn is one of the most common symptoms that a patient comes see their doctor or they take help by seeking over-the-counter treatment, and it's as common as 20% of Americans complain of these symptoms. And it's not only an American thing, it's common in all cultures. If you hear, in the Spanish culture, they call it acidez. In the Italian, they call it agita. So it's one of the most common diagnoses. In most people, it's just a nuisance. It can cause symptoms, called burning in the upper stomach, all the way up to the esophagus and the throat. The message today, if your symptoms are severe enough that require treatment, or you're not responding to treatment, or when you stop the treatment, the disease comes back, it could be a sign of a damage of your esophagus. We call that erosive esophagitis.
And when you're talking about responsiveness to treatment, you're talking about those over-the-counter medications that people are taking for heartburn?
Yes, so if you take over-the-counter medication and your symptoms are mild and your symptoms gone and they are not recurrent or frequent, that could be a sign of a mild disease. I like to refer to the patient, the good, the bad, and the ugly. So if you have it after, the segue of the wine, if you have too much wine, you're having fun in the summer, after Father's Day picnic, then maybe it's fine. You take a couple of antacid and you are okay. But if your symptoms chronic, happens, and progressive and not responding to treatment, is a sign to seek medical help, because it could be a sign of erosive esophagitis, which is a more serious medical condition.
Okay, and you define chronic as, let's say, how long should someone be having heartburn
That's before? A good question, Natasha. So chronic, if you need to be on medication more than 2-3 months.
Oh, okay.
Or if you have symptoms that require, after you stop it, it requires you being on it for years. And a lot of people is like, I don't take it all the time. I take it when I have heartburn. So if your symptoms happen more than once or twice a week for at least 3 to 6 months, that's considered chronic. And that could be a sign of damage of the esophagus. Okay. So there's a difference between acid reflux, which is a symptom. Erosive esophagitis is a disease where the esophagus is damaged. When you damage the tissue, that can cause issues with the patient, because the damage of the tissue can cause abnormal cell, which sometimes can translate into cancer or precancerous cells. The idea not to, again, scare the audience on a nice, Wednesday morning. The idea is if your symptoms recurrent enough, then maybe you have to seek medical help and have an endoscopy where we look down your throat and your esophagus and the stomach and see if there's a sign of erosive esophagitis, or you have other underlying condition, which is a hiatal hernia. Sometimes the junction between your stomach and your esophagus is wide open. Because that's a problem. It's not going to be solved with medication. You need to repair that.
And I want to mention before we go, you do really cover all of this at your center, correct? If people come in nervous about the frequency of their heartburn, you can test them for erosive esophagitis, and if they do have it, get them on their way to recovery.
Yes, so the difference of Midstate Gastroenterology Specialists, we are a private group, one of the last of the Mohegan, as we says, and we can see you in a timely manner. We can take care of you under one sitting with mostly with one provider, and we can have all this procedure and more.
Well, you guys do a whole lot to help people, and really great information today. I think it's good for people to know. Dr. Hussein Wazaz, thanks so much. If you would like to learn more, you can visit midstategastroct.com, and we will be right back. Don't go anywhere.